When I was pregnant, I was anemic. That's why I craved meatballs. I was pale, but my oxygen saturation wasn't low. I wasn't cyanotic with my anemia. But in our patients with single ventricle cardiac anatomy, saturations go down when hemoglobin concentration goes down, and a transfusion of red cells will make the saturations rise. Systemic saturation in patients with single ventricle physiology, total mixing lesions, is made up of the saturation of the red blood coming back from the lungs, the venous saturation of the blue blood returning from the body, and the ratio of these two things. Anemia decreases venous saturation in all people, not just those with cardiac disease. But for pregnant me with two ventricles, it didn't matter how blue the venous blood was. All of it went to the lungs to get oxygenated and came back to my heart 100% saturated. So I didn't become cyanotic, just hungry. That's not the case with single ventricle anatomy, where the saturation of the venous blood contributes to the systemic saturations. So when venous saturation goes down, systemic saturation goes down. But why exactly does anemia decrease mixed venous saturation? Here we should talk about oxygen delivery and oxygen consumption. Oxygen delivery is how much oxygen is delivered to the tissues each minute, and this is determined by the oxygen content in the blood and the cardiac output. Oxygen consumption, abbreviated VO2 for some reason, is how much oxygen all your cells take up and utilize. Bodies have a lot of built-in redundancies, so under normal circumstances, our blood delivers 4 to 5 times as much oxygen as is going to be consumed. So let's draw this out and try to make it super simple. Here's the heart pumping out blood. Here's the body that is going to consume it. Blood then goes back to the heart, where it will head to the lungs to be reoxygenated. I generally try to avoid equations, but there is one we need to talk about, the oxygen content of the blood. Oxygen is carried in the blood in two ways. First is bound to hemoglobin, which is inside the red blood cells. That's represented by HGB in this equation. The second way oxygen is carried is dissolved in the plasma, like salt dissolved in the ocean. That's the PaO2 in this equation. In this equation, the PaO2 is multiplied by 0.0031. That's tiny when compared to the amount of oxygen carried in the red blood cells. So for the rest of this video, we can forget about this stuff out in the plasma, because in reality, only the saturation and hemoglobin matter. So let's start with a two-ventricle patient. Let's pretend that the heart is delivering 4 red blood cells 100% saturated with oxygen to the tissues every minute. That's the oxygen delivery. Given our body's built-in redundancy, the cells only need the amount of oxygen present in one cell. So that all gets absorbed, leaving the other 3 cells saturated, 3 out of 4. So on the venous side, the hemoglobin is 75% saturated, and that's what returns to the heart. Now let's say the patient is anemic, only delivering 3 fully saturated red blood cells a minute to the tissues, because that's all they have. The demand hasn't changed. It's still 1 blood cell of oxygen that's needed. This leaves 2 out of 3 cells saturated on the venous side. They now have venous saturation of 66%. Again, if they have a normal two-ventricle heart, that 66% saturated venous blood still becomes 100% saturated after going to the lungs, and systemic saturations don't change. But with your single ventricle patient, the arterial saturations are already lower. Let's say we are starting at a good single ventricle saturation of 75% in a non-anemic patient. So 3 out of 4 red blood cells carry oxygen on the arterial side. With the same oxygen consumption, that leaves us with 2 out of 4 on the venous side, a venous saturation of 50%. A mixed venous saturation in the 50s in a single ventricle patient is appropriate. Now, make that patient anemic. Oxygen delivery goes down, oxygen consumption stays the same, and so venous saturation is lower. That lower venous saturation that enters the heart mixes with the fully saturated blood from the lungs. It makes the systemic saturation even lower, which lowers the venous saturation more. So if you have a single ventricle patient with low saturations and anemia, a blood transfusion, or maybe a lot of meatballs, should make the saturations go up. What is the target hemoglobin for a single ventricle patient? Well, that's a different conversation.